Hello, everyone. Thank you so much for joining us for this webinar. We are going to be discussing the 2019 Community Health Assessment. I'm Kelly Becerra, and I am the Coalition Coordinator of Healthy Williamson County. Upon releasing this health assessment, we received lots of feedback about wanting more information about the data, how we got to these conclusions. And so the purpose of this webinar is to take a really deep dive into the data so that we can really show how this information was gathered. So before we get started, I just want to give a little bit of a reminder about where this information can be found. So our website, healthywilliamsoncounty.org/CHA, is where you can find all of our information about the community health assessment, along with a lot of the materials that we'll be discussing today. So with that, I'll turn it over to Melissa Tung, who is a project manager for the community health assessment.
Thanks, Kelly. So today we're going to just do a quick recap over what the Community Health Assessment is, also known as the CHA, and then I'm going to turn it over to Shelby to go do a deeper dive into some of the data that we collected for this document. And so just briefly, what is the CHA? And it's a document that we use to collect, use, and analyze data to understand the health status of the community. We use it to develop priorities and to inform evidence-based decision-making among our local public health system, as well as among community organizations such as the health department. We conducted the community health assessment over a 1.5-year period of time, along with our task force, includes 9 different community partners ranging from our hospital systems, Ascension-Seton, Baylor-Scott&White Health, St. David's Foundation, from our local mental health authority, Bluebonnet Trails Community Services, to our Federally Qualified Health Center, Lone Star Circle of Care, to our nonprofits and our foundation, Georgetown Health Foundation, Opportunities for Williamson Burnett Counties, United Way of Williamson County, as well as our coalition, the Healthy Williamson County Coalition, formerly known as the Wilco Wellness Alliance, and Williamson County and Cities Health District. And without them and their partnership, this CHA could not have been completed today. And so how do we go about the development of this CHA? Many of y'all had expressed interest in kind of understanding the framework for the development of the CHA. And so we used actually a framework called MAP. The MAP process also stands for mobilizing for action through planning and partnership. And it was developed by an organization called NACCHO, the National Association for County and City Health Officials. And it is a strategic planning tool to leverage community partners to improve health. And it's a 6-phase process that is pretty flexible, and the CHA actually covers the first 4 steps. And so you can see on the slide that there's 2 different images. There's a roadmap on the left and kind of a wheel on the right, and they both represent the same thing. But I'll just briefly describe kind of how we use this process in developing the CHA. And so when we look at the left image, down in the left-hand corner, you see the first step is to organize for success / partnership development. And this is actually a very important step, and it began around January 2018. This phase is really making sure that all of our stakeholders and all of our community partners are at the table, as well as beginning to define the timeline for the CHA. And so we took about 4 months of planning and working with our task force to begin this process. The second phase is the visioning phase, and it's establishing common values and a common vision for the development of the CHA. And so we did that with our task force as well as our community partners to kind of cast vision for what we would like to see and collect by the end of the data collection process. The third phase, probably the most important phase, is you can see there's this, says the 4 MAP assessments, and this is the data collection process. And these 4 assessments, I would say, are kind of like they help to give a comprehensive understanding of the health of Williamson County. And I would like to think of these assessments as different puzzle pieces. And without one puzzle piece, you aren't able to fully understand the health of the county. And so there are 4 assessments: the Community Health Status Assessment, the Community Themes and Strengths Assessment, the Forces of Change Assessment, and the Local Public Health Systems Assessment. And you take all that information and you take all the data collected, and then you move into your 4th stage, which is the Identifying Strategic Issues, also for us as known as the top 5 health priorities. And that's kind of where the CHA ends and then where the CHIP begins. And so when we look at the 5th phase of the MAP process, formulating goals and strategies is phase 5, and we will be working with our community partners as well as the Healthy Williamson County Coalition in the fall to develop action plans. And the last phase is the action cycle, where we plan, implement, and evaluate action steps for these goals and strategies that we have identified. And hopefully, as we go through this process and we conduct various iterations of this MAP process, it will lead to a healthier community. And so just briefly, wanted to recap kind of what the data collection methods we used over a 6-month period to answer these 4 MAP assessments. We conducted a community health survey, we conducted coalition activities, we conducted focus groups, as well as a variety of different surveys and data collection methods. And we try to use a mixed method of both quantitative and qualitative methods. And so through this, we're able to reach about 2,600 residents and over 300 stakeholders. And so now I'm going to pass it off to Shelby, and she's going to go do a pretty deep dive into how we conducted each assessment.
Thanks, Melissa. So for the Community Health Status Assessment, we really want to answer 2 questions. How healthy are Williamson County residents, and what does the health status of our community look like? And to really answer the health status portion, so the second question, we have to learn about the residents of Williamson County. And so this involves collecting some preliminary data about those residents and really collecting those demographics. So understanding the gender makeup of Williamson County, the age, race and ethnicity, socioeconomic status, poverty, and life expectancy. So we really have to understand these factors in order to assess health status. And so we're going to go ahead and use poverty as an example today. And so we're going to ask some research questions about poverty. So we're going to ask, how many Williamson County residents live in poverty? What does this look like for each racial and ethnic group? And how do we compare, how does Williamson County compare to Texas as a whole? And so you really need to get your research your data sources to answer the poverty questions that I mentioned in the previous slide. And so for poverty, we're going to use the American Community Survey, known as the ACS. And so this survey is from the United States Census Bureau. And it's a nationwide survey, very, very representative survey, and a very reliable way to collect data about our demographics. So we pick this survey that aligns with our research questions about poverty. And then we want to pick a data set that's the most recent available. And so the ACS has a survey that's from 2013 to 2017, and this is where the data stops. Like, we don't have anything past 2000 or anything newer than 2017. We also want to make sure we're collecting data that is reliable. And so ACS does have a 1-year survey that was in 2017, and then they have a 5-year survey from 2013 to 2017. And we're going to go ahead and do the 5-year survey. And the reason for that is when you collect data over a longer span of time, it's more reliable. It includes a larger sample size and includes areas with larger population sizes and makes for a more reliable data set. And so once we have our data source, we're going to obtain our data from that source. And so usually you can download a spreadsheet from that source, so downloading a spreadsheet from ACS, or in some cases you have to request the data from the organization. And then we want to look at certain variables. So in general, you look at place, You look at time, you look at geography, and then you look at some other variables like age, gender, race, ethnicity. You decide how you want that data to be categorized. So if you're looking at age, you want to decide what age groups you're interested in. If you're looking at race and ethnicity, for us, we want to include as many as possible, but you also want to decide what groups you're interested in. And so then you want to also consider if you want multiple variables. So maybe you want to look at gender and race and ethnicity combined. For poverty, we're going to just focus on Williamson County in Texas. We're going to look at it from 2013 to 2017, again, keeping it recent, reliable, and we're going to look at race and ethnicity. So then once we obtain our data, we download it from ACS, we're going to display the data. And so there's different ways you can display your data. The first method is a table. We're not going to use this for poverty, but I just wanted to go ahead and show you guys different ways we can display data. So table would be good for comparing a group to another, or just listing multiple variables together. We also have a horizontal bar graph, and this one is really good, again, for displaying different categories, but especially good for survey data or categories that have a longer description, because you can clearly see the descriptions across the page instead of having them vertical and having to turn your head to read it. It just presents the data in more of a visually appealing way. And then the next one is a line graph, which displays data over time. So if we're looking at a trend in obesity, we would use a line graph to look at that over time. And then you also have maps. So maps are good for any kind of census tracts, zip code, geographic data. But for poverty, in this case, we're going to use a vertical bar graph and a radar chart. And so this really helps us answer our research questions from the other slides that we came up with. So the vertical bar graph compares different groups to one another. So it compares different race and ethnic groups, but it also compares those groups for Williamson County and Texas. Side by side, you can clearly see the blue bars are for Williamson County, the gray are for Texas. And then at the bottom on the x-axis, you have your different race and ethnic groups. And then our radar chart on the right-hand side, this takes a deep dive into just Williamson County and comparing different race and ethnic group poverty levels just for the county. So the gray box in the center of the radar chart represents the percentage of people living in poverty, or sorry, living below the poverty line in Williamson County only. And so that's about 7% of residents. And then the blue box indicates the percentage of residents living in poverty by each race and ethnic group. And as you can see, for the Black population group and the Hispanic population group, the percentage is outside of the gray line. So it's indicating that for those groups, the percentage of poverty is higher. And so that's just an interesting way to present the data so that we can summarize it in a way that makes sense. And so that's what we'll talk about next. How do we summarize our data? Generally, you want to look for highs and lows. So when you look at your data, trying to find high points and low points and compare those to one another. You also can look at percent difference. So you can take 2 points and calculate the percent difference between them and talk about that. You can also look at trends over time. You can compare two groups to one another. So for us in the community health status assessment, we generally compare Texas and Williamson County because Texas is our standard and we're comparing Williamson County to that standard. And then you can also compare groups to one another. So in this case of poverty, we are comparing race and ethnic groups to one another. And so we were able to come up with this summary of that data, which is included in the CHA. And then from there, we can draw conclusions and make recommendations. So we basically are saying, based on X results, based on the numbers, we recommend Y. And so really for this data, we're basically saying that minority populations have a higher rate of poverty compared to other racial groups. And then from there, we can talk about income inequality and make other recommendations and build towards those health priorities like Melissa mentioned earlier. And so once we have some of that preliminary data, we can really get into the health status portion, which is what we really are curious to know. Once we know the demographic makeup of our residents and who our residents are, we can talk about mortality and we can talk about morbidity and healthcare and different behaviors, different self-reported health measures, and the environment that contributes to people's health. And then there's just some examples for each of these that are in the CHA. And yeah, so that is the community health status assessment as a whole, how we got to the data and the findings. But then we also have our community themes and strengths assessment, which is another portion of the MAP model. And so for this section, we asked, what is important to our community and what assets do we have that can be used to improve community health? And so the first part of creating this section was doing a survey, a community health survey. And so for the survey design, we kept it very short. This was a survey that we sent out to anyone in the community could take it. So we didn't want it to be too long or too overwhelming. So kept it at 8 questions, kept it very simple, only used multiple choice questions. But we did give everyone the other option, which creates space for new ideas. And we allowed different answers to be selected. So people could select a limit of 3 answers to each survey question. And we also learned the demographics and zip code of the people who took our survey for further analysis. So these were some of our survey questions that we asked. And then from there, we were able to determine the top 5 strengths. And so because we asked about zip code, we could break this down into different regions of the county and learn about the different strengths of each region. And then the center is just the strengths of Williamson County as a whole. And this was according to those who took the survey. We also did the same thing for health problems. So broke it down by different region and then had it for the county as a whole. And so that is the community health survey in a nutshell. We also did facilitated activities at our community meetings as part of the coalition. And so we took groups and divided them into smaller groups. We had each group discuss different answers to each question that we gave them, and they wrote the answers on a large sketch pad. And groups were timed, and this just kept this was done to encourage the conversation to be kept on topic and to get to the root of these issues. And then we had one question that didn't involve any discussion, just gave people the chance to answer individually. And so these were some of the questions we asked during the community meetings. And we asked these questions because we wanted to learn what our stakeholders think about the health of Williamson County. And so these were some of the results we got. And so what we did was we took the answers people wrote on the sketch pads, we coded them by category, and then analyzed them and put them into these graphs. So similar to what I described for the community health status assessment, we did the same process for these facilitated activities. And so we were able to see what stakeholders' perceptions were broken down by different health issues. And then our next way that we collected data was community focus groups. And this was very much a qualitative data method. And we wanted to capture lived experiences of residents in Williamson County. And then these are just some of the quotes we gathered. And so for the community focus groups, we definitely had a process for how we went about it. We had a lot of prep that was involved. We had a timeline that we developed, and this kept the facilitator and the scribes on track. The facilitator is the one who leads the focus group, and we kept them on a strict script so that the focus groups were all given the same guidance and instructions. And so that way we can ensure the data is more reliable. We also had scribes that could take notes and help the facilitator. We also developed a rules and consent form because obtaining consent from participants is very important. And we also, developed the activities, the questions, and gathered all of the materials. So the gift cards as an incentive, snacks, water. We recorded everybody's answers with a voice recorder so that we can later on transcribe those. And then for the focus group itself, the way it was broken down is we did introductions, we did a sticker activity, which was another way to prioritize and lead to discussion. We also had direct questions we asked the group that facilitated discussion, and then we had a brief closing. So once we did our focus groups, we analyzed the results by coding the qualitative data into categories, so similarly to what we did for the facilitated activity. And then we cross-compared the different categories. We had at least 2 staff doing this, and that was just so, because the coding can be very subjective and how you code can be subjective. And so we had 2 staff doing this coding so that we could compare answers and decide which answers needed to be coded to what category. And then from there, we can identify our themes. And so these were some of the focus group questions that we asked to the participants. And really, the facilitator's job was to just ask these questions and prompt for answers, not talk much. We really wanted to hear from our participants. And so from there, we were able to determine our strengths and assets. So from our focus groups, we learned that these were some of the strengths they determined about Williamson County. We're very good about lending community support, for instance. We have a very relatively low crime rate, very safe neighborhoods, so on and so forth. And then some of the concerns identified by participants had to do with social determinants of health. Should have been another slide, but that's okay. So these were just some of the concerns identified, and we broke these down into different categories as well. So there were not just social determinants, but there were mental health, there were physical health, and so on. And so this is how we captured, again, those lived experiences, that qualitative data, and put it together for the CHA. And so I'm going to pass it back to Melissa to talk about the forces of change assessment.
Great, thanks, Shelby. And so the forces of change assessment is the third assessment in the MAP process, and it answers specifically this question: what is occurring or might occur that affects the health of our community or the local public health system? So kind of what are the forces kind of external to the community that could be things like legislation, technology, impending changes that are affecting the way the community and the local public health system operates. And so traditionally, when we conduct this assessment, you tend to do a survey with a task force or your community partners, and then you conduct a SWOT analysis, identifying strengths, weaknesses, opportunities, threats. But due to kind of limited time and resources, and because we thought our focus groups and our facilitated activities kind of covered some of the similar information, we actually use data from these previous data collection methods that Shelby kind of talked about through our community themes and strengths assessment to identify what kind of are the forces that are affecting Williamson County. And so we took data from our focus groups, kind of key themes, encoded them, as well as through our facilitated activities, encoded them to identify the top forces of change. And so kind of you can see these are the main themes that we identified, and a lot of them you'll see were very similar to our 2016 community health assessment. Some key things to note is that, for example, city development, many of our community partners as well as our focus group members talked about how our cities are rapidly urbanizing and gentrifying, especially areas that tend to be more rural, and cities are being developed all across the county. And you can see that some of these forces are also very, very intertwined, hard to separate out, for example, current events from political climate. And so these are just kind of some of our forces of change. But one thing we wanted to do was that we knew that forces kind of don't operate outside of one another. And so we wanted to create these force field diagrams that shows how different forces are opposing or working together to affect some of our main health issues. And so in the CHA, you'll see two force field diagrams. And so you can see here, we developed a force field diagram in relation to increased access to community resources. And this is one of a top priority of many of our community partners, how we have many resources in Williamson County, but how do we increase access to them? And so you can see on the left-hand side, there are driving forces, and then on the right-hand side, there are restraining forces. And under each force, there's kind of a quote that we extrapolated from our focus group to kind of describe what we are seeing. And so one of the driving forces of increased access to community resources is there's increased population growth. One of the quotes is, hopefully there's more things as Taylor grows, which it's going to grow. The more people that move in, the more resources, the more money, and we're able to provide more community resources. However, on the right-hand side, you can see there's some restraining forces of people accessing resources. The political climate, the increasing fear in accessing community resources kind of limits or prevents people from wanting to access them. The quote says, I put that one up there, and just because of the national level, the things that are happening, I think that it'll impact people not wanting to inquire about service. It'll scare people away. And so kind of these forces are, we just wanted to give some diagrams of how Williamson County doesn't operate in a silo, and our cities don't operate in a silo, that it's part of a dynamic environment in the state, in the national level. The last assessment is the Local Public Health Systems Assessment. And this assessment specifically answers two questions. What are the components, activities, competencies, and capacities of the local public health system? So basically it's saying, how is the local public health system operating? And then the second question is, how are the 10 essential services being provided to the community? So you might ask, what is the local public health system? And this is basically any entity or organization that delivers one of the top 10 essential public health services. And so you can see this network map. It's not just the public health agency, it's not just the health department, but it can be law enforcement, it can be employers, it can be fire, mental health providers. The local public health system is complex and large. And what are the 10 essential public health services? You can see this wheel that we kind of at the health department we live by, from assessment to policy development to assurance. And so how do we assess this large, complex local public health system survey? How do we assess the local public health system? And so we actually adapted a survey, also from NATO, to kind of assess the top 10 essential public health services that are being delivered by this system. We partnered with our task force and our district leadership team. We believe that they probably have a good understanding of what the local public health system, how it's operating, and kind of what services are being delivered. Obviously, it doesn't include all our community partners and all the partners that you saw earlier in the network, but it was just a good baseline assessment to assess the system. And so we took and identified indicators to measure performance in relation to each essential service. And so we identified 33 performance measures. And we asked, for example, how well your organization delivers this public health service, and then how well is the local public health system doing. And survey respondents rated between no activity to optimal activity. And so kind of the results in a nutshell is that the best ranked essential public health service being delivered was our ability to mobilize community partnerships. And then our lowest ranked was assuring a competent workforce. So for example, like developing like cultural competency and providing additional opportunities for the workforce in the local public health system to receive training. And so we took all that information and all that data collection, and then we identify the top 5 health priorities. And so you can find the top 5 health priorities on the CHA webpage and in our documents, but wanted to show you kind of how we prioritize, how we identify these priorities and how we prioritize that. And so what Shelby mentioned earlier about how we did a community health survey and how we did a focus group activity, and as well as a facilitated activity at our community meetings, our community partners, our focus group participants, and our stakeholders actually rated and ranked the top 5 health problems. And you can see that it's color-coded. Yellow is mental health issues, green is orange, and you can see how each topic kind of shows up in the ranking. And we have a cool video that's also up on our website that kind of describes a little bit more about our top 5 health priorities. Lastly, this CHA cycle, we wanted to identify health equity zones. And like many of y'all probably heard, that these are areas we saw that we use data to identify areas that tend to have worse social and economic indicators, which tend to have worse health outcomes. And so we have 5 health equity zones that we've identified across the county, from Leander to Round Rock to Taylor to northern rural Williamson County to Georgetown. And so how did we identify these areas? They weren't arbitrary. We actually used census tract level data, or basically neighborhood level data, to identify these areas of need. And so in this matrix, you can see on the left-hand side that we chose specific measures that we had available for neighborhoods. Not all data can be found on a neighborhood level, and so many of this data comes from the American Community Survey, and they're usually related to social economic indicators such as living below poverty, median household income, access to grocery stores, etc. And so we looked and compared across the county areas that tended to have their values were less than the county value. And you can see at the top that we have indicated the 5 health equity zones as well as the values within each health equity zone. So let's look, for example, median people living below poverty level. The county value is at 7.2%. For Georgetown, the percentage range between 14.5 and 15.2. And so we color-coded that as red because this measure is actually worse than the county value. But when you look at the northern rural site, the percentage ranges of people living below poverty is between 6% and 22.4%. And this actually is better and worse than the county. And so to kind of show the differences, we actually color-coded it as yellow. And so this is a matrix on how we identify the health equity zones. As well, we floated these zones to our community partners that were working in those areas and conducted windshield surveys to confirm these zones. And so that's kind of a brief deep dive of how we came about to our conclusion. And so now I'm going to turn it to Kelly to finish us off.
Awesome. Thank you, Melissa and Shelby. So as you can see, this deep dive, that's a lot of information. And so it just really goes to show the process and what it took to really get this community health assessment published. And so now moving forward, there's a lot of things that we can all do to get involved. And so primarily the next steps is going to be focusing on Healthy Williamson 2020 to 2022. That is our new community health improvement plan that we will be updating. And so we'll be working with the community partners. And as Melissa mentioned earlier on with the MAP process, that's where the community health improvement plan comes into play, is the next step after the community health assessment. We also, as we mentioned, our website, healthywilliamsoncounty.org/CHA, has a bunch of really wonderful information and resources on it. And so we would love for that document to be shared. We also have a really short version of the community health assessment called the executive summary. And so that's actually, how many pages, Melissa, is that? 12 pages. So a really great way to read the highlights of the community health assessment or share a brief version with your colleagues so that they are not overwhelmed with a very large document that you share with them. We're also able to give different presentations, and they're really flexible. They can be shorter, longer, and they can be a deep dive like this, or they can be brief. And really a big goal from the beginning with the task force and with our internal group was to focus on making all of this information really interactive and useful. And so we didn't want the community health assessment to just be published and that was the end of it. And so for the next 3 years, we actually have resources and like infographics and story maps and things that are really interactive that you can use over that course of the time. So we expect that these are going to be really valuable. It's everything from city infographics to the top priority infographics, maps, interaction, things like that. So those are all on the website. We also developed social media toolkit posts, And so again, these posts can be used throughout the next 3 years. They have different highlights and data and graphics on them. And there's also post descriptions underneath that you can just copy and paste onto your own social media site. So it's really easy, and it's a really great visual to share some information about the community health assessment. And then again, Melissa mentioned our task force, so we just want to acknowledge them once again because we could have not done this without them. So thank you again to our community partners and to all of our partners that were part of the stakeholder groups or the focus groups or really helped us to connect with the community. We appreciate you very much. And so with that, we have some contact information for our presenters, Melissa and Shelby. So if you do have any questions about the data portion, the process, anything that we just talked about today, please feel free to reach out to Melissa and Shelby. And so with that, that concludes our webinar. So thank you very much for joining us, and feel free to interact with us on healthywilliamsoncounty.org/CHA and reach out to us if you need us.